there are protocols for longevity, anti-aging, cognitive optimization, sexual health, weight loss, gut health, immune function. I mean, you name it, there's probably a peptide for it.
3, 2, 1.
Here we go!
All right. So welcome to the Dr. Doug Show. This is episode 3. This is where I bring together two critical components of self-mastery, HealthSpan and mindset. The topics I talk about here will help you to improve both your body and your mind and to help you live better, longer. So today we're going to talk about one of my favorite topics, which is peptides. This is going to be just a summary of what is peptides, an introductory course, a 101 of what are peptides, how are they used in a medical practice, and whether you are a consumer, a patient, a provider. This is going to be the 101 course that I want everybody to come back to when I do future topics of specific peptides, because we don't need to keep repeating this part over and over again. But there's a lot to learn here about what these things are. I started getting very interested in peptides out of the gate. So I did some additional training. I got a certification from A4M in peptides, because there are some ways to screw this up. There are some ways to hurt people. There are some things that you should definitely avoid as both a provider and a consumer. So I want to define what these things are. I want to talk about who should use them, who should consider not using them, where you should actually get them from and where not to get them from, and then the controversies around them, which is really important, I think, for providers, but also for consumers to understand if your provider is acting in a certain way or recommending things in a certain way or prescribing in a certain way. These are things that you should probably watch out for. So let's dig into this. First of all, what the heck is a peptide? So a peptide, if you have heard of these in the media, or if you even go to your pantry and you look up some of the products sitting there, you might find the word peptide. And a peptide, just from a simple definition perspective, is a short protein, right? So proteins are a series of amino acids, and a peptide is a short series of amino acids. Usually between 2 and 50 amino acids will make up a peptide. Longer than that, it's going to be called a protein. In the body, these things can be used in a lot of different ways. There are different forms of them in the body. There are peptide hormones, peptides that are not hormones, but basically they're all signaling molecules. So they will have a receptor, they will have a specific action, and what happens when you use them is predictable, and the body makes them naturally, which is something that I think is really important to understand. Most peptides are natural, but not all. And this is where you have to really understand what you're prescribing or what you're being prescribed. So I wanted to compare hormones and peptides, because I hear this a lot, or I'll hear people say the opposite, which is, well, I take peptides and my collagen are peptides, and that's all I need to know about peptides. And there are collagen peptides, and they are chopped up collagen molecules, because collagen is a big protein, and chopped up collagen molecules are collagen peptides. They're absorbed better. That's why you use them. But in the body, what we're looking for are the peptides that are actually going to connect with the receptors. This can happen on the outside of a cell generally, and it's going to cause an action inside the cell, versus hormones. Most hormones will actually cross into the cell, cause a reaction in the cell. They're both signaling molecules, but peptides their action is a little bit different. But again, there is some crossover, so there are peptide hormones. So it's sort of a combination of the two. Some of those peptide hormones you might have heard of, like oxytocin, insulin is a big one we're going to talk about, glucagon. So these are actually peptides because they meet that definition, but they're still also considered hormones because of where they come from and where they act. They are different from drugs. I'll talk about how the drug companies and the FDA view these things. It's a little bit interesting. And they are different from supplements, meaning that they are not available over the counter. I'll talk about how there are some direct-to-consumer options out there, and what you need to be concerned about with these, the things that are truly over-the-counter versus prescription. So let's actually get into that now. So when I talk about the fact that I prescribe peptides in my practice, and people will say, "Oh, well, I can get those over the counter." There's a couple of different ways to look at this. So one is that the things that we prescribe are not available over the counter for the most part. I'll talk about direct to consumer in a little bit. But when you see a peptide that is considered over the counter, it is regulated in such a way that it has been approved to be delivered directly to consumers without a prescription. Those things have been evaluated, and they are in general going to be defined as benign by nature. They may have an impact. They may not be, a placebo, but they're going to be benign by nature. They're going to have a very high quality safety profile. In other words, like a collagen peptide, right? Like you don't need a prescription for a collagen peptide. It's hard to overdo a collagen peptide. It is going to be used generally for wellness, anti-aging, and there's not a lot of potential for misuse. I don't know anybody that's OD'd on collagen peptides. So these are the things that are going to be available over the counter, and they don't really need to be monitored. That's why they're available over the counter. So then you look at the things that need a prescription. So we'll talk about what these things are, but the things that need a prescription are things that are going to have an increased side effect profile. So potentially you could go wrong with this. Or if there's a specific medical indication, and we'll talk about the FDA in a little bit. There's also, if there's concern for the potential for misuse or abuse, if there's an increased need for monitoring, or if they're just newer to the market and the governing agencies just don't know, and there's some regulatory decisions to make, they might make these things required to be prescribed, and that's fine. I mean, this is what we rely on governing organizations to do, for better or for worse. And so the ones that we use in general are going to be prescription. Now we might recommend something that's over the counter, but in general, we're going to be talking about the prescription version. So I want to talk a little bit about the history of peptides, because I hear often, especially on social media, that these things are new. Like there's these new things out there and they're going to change your life. Well, that's not exactly true. There are some new things out there, but for the most part, peptides have been around for several decades. In fact, if we go all the way back to the first identified peptide, I mentioned it earlier, which is insulin. Now, insulin obviously crosses over and is also a drug. But insulin is a peptide hormone that was first used in 1921. And so there have been several different versions of this throughout the decades, but these things have been around for 100 years. It was a while before we started identifying more usable ones like calcitonin, sermorelin in the 80s and 90s, but still these things have been around for 30, 40 years. There are a lot more of them available now. So the last couple of decades, the research has really pushed that. But they have been around for a while. I hear a lot of questions too about, are they safe? And I'm going to talk about the research in a little bit, but I wanted to just reiterate some of these things, that they are natural for the most part. They have been around for decades. They are reacting to receptors naturally. So the receptors that they're attaching to are a natural receptor, and they are the key for that lock. So it's a normal thing. They generally are going to have less side effects than something that's unnatural, like a pharmaceutical, or most pharmaceuticals, but recognize that there are potential risks. So for example, I keep bringing up insulin. Insulin, if used improperly, can absolutely kill you. Most of the other peptides, not quite going to have that impact, but you can certainly overdo it. But remember too, that even over-the-counter supplements, if you were to take calcium by itself, something as benign as calcium, take calcium by itself, and it'll increase your risk of heart attack and stroke. So nothing is without risk. The old cliche, the dose makes the poison, is absolutely true. And I'll talk about dosing when it comes to especially direct-to-consumer products, because the dose is actually very challenging to figure out. But in general, these things are going to be very safe and have a very favorable safety profile compared to, say, a pharmaceutical. So before we get to the next section, I just want to take a quick moment to say that if you are watching this on YouTube, just do me a big favor, take a moment to click the subscribe button. Helps me to reach more people, helps us to get this information in the hands of more people that are looking to improve their health span. Speaking of HealthSpan, if you haven't heard of or joined our HealthSpan Nation yet, this is a group of like-minded people that are probably like you, that want to improve your health, want to live better, longer. And it's also where we do a weekly Q&A with myself or a team member. Sometimes we do interviews. It's where we have our discount codes for the products and the companies that you see here on the podcast. We don't do sponsorships. This content is totally free, but if you want more information or potentially discounts or deals on those things, then please join HealthSpan Nation. To figure out more about that, just go to drdouglucas.com. It's got all of the stuff in there. All right. So let's talk a little bit about why we would use them. And I get this question a lot, especially when people don't know that there's more than, say, a collagen peptide out there. The thing is, when it comes to peptides, there are so many potential applications. And I want to be very clear here to say that I'm not talking about clinical indications. We're not treating disease with these things. These are potential applications, and we are looking really at functionality. So these are, again, not FDA approved. I'll talk about the FDA in a second. They're not FDA approved. They are not for a specific indication like a disease process, but we can use them for more general things like health optimization, building muscle mass. You might have heard of something like sermorelin or CJC ipamorelin or ibutamoren, AOD 9604. These are peptides that we use that are great at sort of increasing IGF-1, flipping that switch, and increasing the ability to be anabolic, right? So you want to pair this with the right nutrition approach, the right exercise approach. They're not magic. They're not anabolic steroids, but they can certainly push you in that direction. Recovery is a really important one for our athletes, for our high performing CEOs and physicians. I love BPC, TB4, TB4 frag. There are protocols for longevity, anti-aging, cognitive optimization, sexual health, weight loss, gut health, immune function. I mean, you name it, there's probably a peptide for it. How effective it is, that depends on the peptide. But there are so many different areas where we can potentially use these things to, again, just create that pyramid of optimization of those tools that you want to utilize. That's including the foundation, including the supplements. And then we get into hormones and optimization of peptides. So then if that's true and they are so awesome, then why isn't everybody using them? And it's because of a lot of reasons. But I'll start with this, that it's just a murky space. As I mentioned earlier, the FDA does not approve these things because they are not made by drug companies. Therefore, they are not pharmaceuticals. They are not drugs. But they are by prescription only, and they're made in compounding pharmacies. So there are plenty of doctors who would say, look, I've never seen a big trial on this thing. It wasn't made by a drug company. I'm just not comfortable with it. And that's fine. They don't have to prescribe these things. But you got to remember that the way that the FDA and the drug companies are set up, we have to respect that drug companies are going to be mostly motivated to use and create and market novel compounds, not naturally occurring things. So if something is naturally occurring, they're going to be less motivated to develop it because you can't patent something that's naturally occurring unless you change it in some way, like a delivery method or whatever. And so they're not motivated to study these things. Some of them have been studied by drug companies and didn't make the cut, and that's a whole nother conversation. But in general, the FDA is going to approve things that are made by drug companies, which are generally going to be novel agents or synthetic compounds, not natural things. So peptides kind of get left out in the dark. And then there's also the challenge of compounding pharmacies. And so plenty of physicians are uncomfortable using compounding pharmacies. This is also an issue with bioidentical hormone replacement, compounding creams, testosterone for women. I mean, just name it. This is the space we live in, though. So we use compounding pharmacies for a lot of things. And the key here is that you need to understand your compounding pharmacy. A lot of patients will ask me to, hey, can you just prescribe this to my local compounding pharmacy? I'm very hesitant to do that because I'm on the hook for the potential side effects and risks of whatever you're taking, and I don't know how they're making it. And so we will generally use our nationwide compounding pharmacies that have really tight oversight. And I'm very comfortable with that because I know that they're producing what they say they're producing. Let's talk about the research. There is research. There is limited research, especially on some of these things. And this is where working with a provider who is comfortable knowing the research and reading the research is really important, because the compounds that I'm using, I will only use compounds that have human research behind it. And then I read the research to make sure that I'm comfortable with it. What I'm going to do here in the future on this podcast is to talk about some of these compounds, present some of this research so that we as a group can understand, hey, this is a peptide that has pretty good evidence behind it. Let's ride this and see how it works for us. But there are plenty of compounds that are out there and available that have very little research. I'll talk about some of those differences in a minute. Another reason why physicians might not want to prescribe them is that the dosing is pretty challenging. It's already mentioned that the research is not as good as a drug, but the dosing is challenging because, again, we don't really know, right? So we have limited research. There have not been great trials. So what do we do? Well, we do the best that we can. We use the evidence that we have. I'm not extrapolating from animal studies, so I'm using human research that had outcomes. So at least we have that. We know that we should be under certain safety thresholds, but the dosing is challenging, even if you have good data. And generally, these things are coming in the form of injections. They're coming in vials, and you have to draw them up. So there's just more to it, and it can be challenging from a busy traditional medical doctor physician perspective to be able to prescribe these things because it takes more effort. I've recorded videos for my patients. I show them how to draw it up, show them how to do the injections. So it is laborious on the physician and the team's end to be able to help people to get going with these things. Once you're up and going, it's fine. It's just a matter of taking that next step. So let's dig into the research a little bit more. So I mentioned that there are not large human trials for most of these things, and that's true. Again, I'm only using peptides that have human studies, but there are plenty that don't. I just don't use them. A lot of these, most things, to be honest, are started out with animal studies, right? So they come off the bench. We understand what they are, the mechanism, animal studies, what are the outcomes, and then human studies. But they're going to be generally smaller human trials unless they've been studied by a drug. Maybe they hit, some early larger trials for drug companies, and then they didn't make the cut into a drug for whatever reason. So then you might actually see some bigger numbers. But generally, we're going to see smaller human trials. What I like about the certification that I have gone through, which I mentioned at the beginning of this podcast, there is a new group out there called the International Peptide Society. So the International Peptide Society is trying to bring together all of the countries, the providers, everybody who's trying to bring this forward to the general population. So I'm a member of the International Peptide Society, and one of the great things that they do is to bring in all of the research. They're always adding to the body of research. And so we can go in there and look at a certain peptide and look at the research behind it and look at the new trials. And it's a really great way if you're a physician to feel comfortable with prescribing these things, because you can see, what is the recommended dosing? What are the listed side effects? What is people's experience? And learn about other docs who are prescribing these things. Consumers can also use the International Peptide Society. You can find providers on there. You can learn a little bit, I think, about the things that are on there. Another challenge that I've seen here are physicians making bad claims. And this is where some people might be pulling back away from these things. This was especially relevant during the pandemic when there were some claims made about a specific peptide called thymosin alpha 1. TA1 is a really popular peptide, or I should say was a really popular peptide. Lots of people with chronic immune dysfunction were using it to help manage symptoms, and anecdotally, really good experience, right? Unfortunately, somebody or some clinic made some claims about its ability to have an impact on a certain virus that's been in the news quite a bit over the last 4 years. And as a result of that, the FDA pulled it. So nobody is allowed to actually manufacture that anymore, which is really unfortunate, because I have a number of patients who were on it, managing symptoms with it, and we're doing really well. And now without it, they're desperate. And so I'll talk a little bit about how the things that people are doing to find these things. I think another issue that people struggle with, or at least doctors struggle with, is kind of the ethics behind this. And this gets into what I talk about in my bone health YouTube channel often, is the difference between a cash pay practice and an insurance-based practice. It's difficult for a traditional insurance-based practice to offer things like peptides, because insurance isn't going to cover them. They can be expensive, but not always. But you have to be in the cash pay space in order to have basically the system in place to be able to order them, to monitor them, to take payment for them. And so from a provider's perspective, it can be kind of difficult to actually to have these things be a part of your practice. And then when I was getting into it, I saw such variability in pricing. You see a peptide like the GLP-1 agonist, for example, like tirzepatide. So they are, I've seen people selling tirzepatide for, $2,000, $5,000 a month, because the commercial product is so expensive. So you could argue, hey, if I can compound it, I could sell it for a third of the cost, and that's a deal. But the truth is that that's a massive markup from the cost for us. I know what it costs for me to get tirzepatide. And so I'm not comfortable from an ethical perspective having a big markup on peptides. The way we do it is that people are rolled into our membership, and then we essentially don't need a margin on our peptides, right? So we don't mark up anything substantially, but you have to get in the door. You have to be a member of our program, and so that's where we establish our operating costs. And so we're not trying to mark things up, and their physicians are rightfully afraid to do that because that will run in the face of some potential ethics concerns from a medical board for marking up things that you're selling direct to consumer. So that's a real concern, and you just have to have the right practice model in place, and most practices don't have that. And then I just mentioned this about tirzepatide as a good example. So tirzepatide is a drug that is still under patent, right? So tirzepatide is Mounjaro, and excuse me. So as I was saying, tirzepatide is Mounjaro, and Mounjaro is still a patented drug. The compounding pharmacies are able to compound this because they change it enough to meet the legal criteria that it's different. But they do that by adding other stuff to it. So there are actually some lawsuits out there right now on this topic because obviously the drug companies feel like they're losing market share, and that's absolutely true. So there's some reasons to potentially, as a physician, stay away from that as well. But as long as you are practicing with integrity, I think you're probably fine. So then the next question is, who should consider using these things? And I think the answer is there probably isn't a person on the planet that wouldn't benefit from one peptide or another. The question is, how motivated do you want to be in your own care? How much time, effort, money, if these are injectables, how much effort do you want to put into this? And so most of my patients are interested. They're not all interested in injections, which is fine, but they are interested in peptides. They're interested in taking that next step, having that extra layer of optimization. And so we see this in areas like performance, anti-aging. We can call it optimization in general, just feeling better, having better energy, vigor. Immune dysfunction, as I mentioned earlier, improving muscle mass, cognition, and weight loss are all categories that we have peptides for. So there are a lot of different options available, but it really depends on the prescriber's experience, I think. And there are a number of docs out there who are kind of dipping their toe in the peptide space, and they'll offer like two things, and that's fine. But if you really want to understand how to run these things, the people that do this a lot, and this is the way I do it for myself, is that we basically will create stacks together. So we create synergistic stacks of peptides. You run them 2 or 3 at a time, and you go for whatever the duration makes sense. Some of the stacks are short, so sometimes it's a 3 to 4 week run of 1 or 2 different things, and then you rotate to another thing. And you basically, what we've created are these programs where you can kind of just rotate, and you can be, anabolic. You can work on, anti-aging for a time period. You can work on autophagy and telomere length, and then you can switch, and then you can build muscle mass, and then you can switch, and you can work on immune dysfunction. And you just kind of keep going based off of what your goals are and what you need to work on for yourself. But I can't say strongly enough to work with somebody who knows what they're doing in this. And also, if you are being told to go to some of the companies out there that are direct to consumer, just be very wary that if these are prescription products that are direct to consumer, these companies exist because they are providing product for research. I think there are probably a lot of people that are using them for personal use. I can't speak to what the intention of the companies are, but you can get them that way. The biggest challenge here is in dosing. In theory, there's not as much observation. There's not as much oversight over production, and you're injecting these things into your body. So I would strongly discourage anybody from using direct-to-consumer products because the dosing is a challenge. I don't want to say that the companies aren't making good products. I don't know that that's true, but I know that the compounding pharmacies are under such tight scrutiny. I think it's worth the extra money to pay for something that that you're getting the product that you're getting. And from a safety perspective, you know that there's enough oversight that they're not going to be making something that's likely going to harm you if you're using the right dose. So strongly encourage you, don't DIY this one. This is something that you really want to work with somebody who knows what they're doing. And then pick a goal. And so just pick a goal and have the right stack presented to you and presented for you. And then just knock that thing out and really use it to help hit your goals. And these things are a lot of fun. I've really seen some big changes in my own life as I've started to use them. So I think that's enough of me blabbering on about peptides. I hope that clarifies some of the basics of these molecules and how we're using them in practice and how it's a powerful tool to consider. And remember that if we are created for greatness and we're trying to seek optimal, not average, these are some of these things we can use to help be extraordinary. And being extraordinary is what it takes to achieve those goals. So if you found this helpful and you haven't yet, please click that subscribe button on YouTube or leave us a review on any podcast platform. If you want to learn more about our HealthSpan Nation, just go to drdouglucas.com and you can check that out for discounts, resources, recommendations, our weekly Q&A, and our group platform where you guys can share thoughts and tools with each other. So I think it's a really cool place. Happy to see everybody there. Thanks so much for your time here, and I'll see you on the next episode.